Hello everyone, I am Dr. SunilKumar, consultant pediatrician and neonatologist, People Tree Hospital, Yeshwanthpur. Every year, November 14th is celebrated as Children's Day. Children's Day, the day is celebrated to create an awareness about caring of child, the rights of child, and education of a child. Every child should get compulsory free elementary education from 6 to 14 years of age, and every child should be protected against child labor, abuse, and every child deserves tender love and care. As a neonatologist, I would like to give some tips regarding newborn care and their nutrition. There is something called as first 1,000 days of life. It starts from the day you know you are going to conceive, like the day one of your pregnancy, until the second birthday of your kid. So this is the window of opportunity where the foundations are laid during this period for a good health and proper neurodevelopment for the further lifespan. So if you put your more efforts during the first 1,000 days, then you can have relaxed during the later period. Okay, so you need to listen to your obstetrician advice when you are pregnant, and you need to start, I insist on exclusive breastfeeding during the first 6 months of postnatal period. And later, you need to continue your breastfeeding and you need to go for age appropriate complementary foods. See, there are a lot of confusions regarding complementary foods. See, there is no fixed formula where I can just give you and you can just relax quietly. So it is just trial and error where every mother can find their best formula suitable for their family and for the kid. Okay, so it is like the first 6 months. The baby solely require on liquid based diet like breast milk, and it should be exclusive. There should not be any interference with any formula unless it is really required and prescribed by a qualified pediatrician. Then only it should be used, rather than a self decision or emotional factor like my baby is crying a lot, something kind. Okay, and complementary foods, you should go by step, where after 6 months you should go with the semi-liquids, semi-solids, porridge-based diets. Basically, the major cereals based on rice-based, wheat-based, or ragi-based malts can be prepared. And during 8 to 9 months, it can be made little semi-solids, plus there should be introduction of solids. And by 1 year of age, where your child should at least be able to eat around 20 to 30% of the whole full diet should be solids. So that should be the how you need to go, and there is no fixed formula. So you need to trial and error, and don't label your child as my kid doesn't eat this, doesn't eat that. The child preferences may vary for one day and other days. So keep trying repeatedly. Okay. So that's what I want to give you. Okay. Thank you. Thank you.
Hello everyone, I am Dr. Mallikarjun. I am a consultant pediatrician and pediatric intensivist, People Tree Hospital, Gorgantapalle, Bangalore. On this day of Children's Day, I would like to wish all the children a very happy Children's Day. And on this occasion, I'll take this opportunity to talk few words about infections and infection control as well as immunization. You know, infections are one of the most common causes of childhood mortality and morbidity. Some of the common infections, especially in the last century, are like tuberculosis, diphtheria, tetanus, pertussis, mumps, measles, and hepatitis B are very common in the last century. But in the present century, there is a lot of change in the trend in the infectious diseases among our children. And in the present, recently we have noticed that the COVID-19 is one of the infectious diseases which has change the entire scenario in the world and also the practices. These infections are potentially preventable by a simple and cost-effective measures like personal hygiene, environmental modifications like prevention of the overcrowding, and last in the immunization. I would like to talk about a few words about immunization. Immunization is a simple and cost-effective method of prevention of infection in children. As you know all, immunity in children is very immature and it is evolving. As they evolve, they are exposed to the different kind of infections and then they develop the immunity. But in children, they are exposed to different kind of people who are elderly people in the home or even in the schools. They are exposed to kids who are affected with many infections. So in that way, they contract the infections and they will suffer, and the cost involved in treating these infections is enormous. So infections prevention can be done by simple methods like immunization, which the cost of which is far less than the treating an infection once the child is acquired. And these infections can be in the immunity, immunization means nothing but you are training a baby's body to get an infection, get antibodies against the pathogenic bacteria, so that whenever they get the infection, they can fight against these infections. And you must be knowing there are different immunization schedules in India, like Universal Immunization Program, and there is another schedule called Indian Academy of Pediatrics schedule, and also there is some people also practice American Academy also, but all of them are based on the different individual countries and their priorities. And some people, and especially parents, ask me whether this vaccine is compulsory, or whether some people ask that this vaccine is optional, why should we take? But according to me, all vaccines are essential. In the previous century, there are diseases which are very common like tuberculosis, diphtheria, pertussis. Accordingly, universal immunization program was scheduled. But there are many other illnesses like pneumococcal vaccine, pneumococcal infections, or meningococcal infections, hepatitis A infection, which can be prevented by vaccines, and they are available at present. And according to me, if all the children take most of these vaccines which are presently available in the market, they can prevent all type of infections, and also their health burden can be reduced in the community. So I strongly recommend that if parents are can afford, better to take all the vaccines which are available in the present days, and also they can help in the prevention of the life-threatening complication in their children. Thank you.
Hello everyone, I am Dr. Sharmila, consultant pediatrician and pediatric endocrinologist at People Tree Hospital, Yeshwanthpur. As we celebrate Children's Day on this Sunday, 14th of November, I would like to share a few words on what this Children's Day means to us as children's healthcare providers. The theme for this year's Children's Day is Children Above All. Children's Day offers us an opportunity to advocate, promote and celebrate children's rights and to build a better world for children. This year, COVID-19 crisis has resulted in a child rights crisis, and the costs of the pandemic on children have been huge, and if unaddressed can go irreversible. It's high time for all of us to come together and reimagine and create a better world for them. And when we talk about childcare, the most important thing to address will always be taking care of their physical and mental health. After all the toll that these lockdowns have taken on them as much as on us as adults. Growing well, that is falling within the normal growth centiles, is the most important indicator of a child's well-being. And this is the end result of all the nutrition that is provided to them. Due to on and off lockdowns, restrictions on outdoor activities, faulty feeding habits, excess screen time and sedentary lifestyle, we have seen an increase in children with overweight and obesity, more so for the past 2 years, which has resulted in children getting diseases which are usually assumed to be adult in onset, such as high blood pressure, diabetes, high blood cholesterol levels, risk factors for heart disease and non-alcoholic fatty liver disease. Hence, I would like to focus on 5 things we could do to help ensure that our children have good health and in turn good physical and mental health. The first thing in order to make our children eat healthy is to aim for a balanced diet and varied diet for the whole family. It also always has to be a family-based approach where you ensure that you all have 5 portions of fruits, vegetables and greens per day. The second point, encourage your child to eat meals at regular times and to watch how often they are eating. They should avoid snacking as much as possible. Even when they snack, it should be healthy snacks in the form of homemade salads, sprouts, cut fruits, or homemade vegetable soups instead of sweets, cakes, and biscuits. Ensure that they have low-calorie drinks such as buttermilk, tender coconut water instead of sugary flavored artificial drinks. The third point is to encourage your child to watch the portion sizes that they eat. Many a times they may just be eating all homemade but excess portions of all, leading to overweight and obesity. Try to eat meals in a sociable atmosphere as a family without distractions. For example, do not let your children eat in front of the television or with a mobile in their hand. The fifth point is snacks or food should not be used as a reward, especially in work from home scenarios where parents and everyone at home is struggling between office and house chores. It's an easy way out to get kids to do their homework or to keep them happy on their own by just giving them snacks or food as a reward, but this should be avoided. So with these simple dietary modifications, I think we can ensure that our kids stay physically and mentally fit, which isn't just a one-time plan, but rather the key to lifelong good health. Happy Children's Day. Thank you.
Let's keep children above all. We wish you a very happy Children's Day.